Uh, Good afternoon, everyone. My name is Dr. Latika Athauda, and I'm from the University of Kelaniya, Department of Public Health. And this study is about alcohol drinking and social media use among school-going adolescents in Sri Lanka. The study was conducted as a part of my PhD, and my supervisors are the co-authors here from the University of Auckland and the University of Kelaniya. Right. So social media use is increasingly more and more adolescents are increasingly engaging with social media use, as we can see. And social media use has not been studied against alcohol use in the Sri Lankan context. And also we have seen that social media is very increasingly sort of promoting more and more unhealthy commodities to young people. And so this study set out to describe the association between social media use and drinking among school-going adolescents in Sri Lanka. We conducted a descriptive cross-sectional study as a part of a larger study. The study population was grade 12 and 13 students who were attending either public, private, or international schools in Colombo. We used an online data collection tool to look at their social media use and alcohol use behaviors. And then we analyzed the data on SPSS version 26. And we were very interested to see how they use social media, and we tried to categorize social media use as high, medium, low, or no use. How we did that was we looked at different social networking site use like Facebook, Instagram, Twitter, and so on, and also messaging app use like WhatsApp, Viber, Snapchat, and so on. So if they were using at one social media networking site or a messaging app, at least one daily, they were classified as high users. If they were using it a couple of times a week, they were classified as medium users. And if they were using about roughly once a month or sometimes, we classified them as low users. So what we did find was that the study participants were largely males, about 57%, and they were between the ages of 16 to 19 years. Majority were public school attendees. And we found that their ever drinking prevalence was 16.2%, and the current drinking prevalence, which means having had alcohol within the past 30 days, was 6.4%. What we were interested in looking at was comparing ever drinking against social media use. So as you can see in the diagram, that Facebook and Instagram use were the most popular social networking sites that were used by these adolescents. And regarding the messaging apps, WhatsApp was the most popular one. And then we tried to compare between high, medium, and low use. And we found that there was a statistically significant difference between high, medium, and low use against non-users and their drinking behaviors. And we found that the odds, high social media users were 8.8 times more likely to be ever drinkers when compared to non-social media users. Likewise, medium level social media users were 7.3 times more likely to be ever drinkers compared to non-social media users. And when we looked at the different social networking site use and the messaging app use, the most popular networking site, which was Instagram. So daily Instagram users were 9.7 times more likely to be ever drinkers when compared to never drinkers. And also daily WhatsApp users were 9.3 times more likely to be ever drinkers when compared to non-WhatsApp users. And Facebook came at 3.8. So looking at the results of this section of the study, we do learn that Sri Lankan adolescents who are using social media are very, very likely to be consuming alcohol compared to those who don't use social media. However, as a next step of the study, we want to look at what on social media exactly influences these adolescents to drinking. So we're looking at, hopefully, to look at alcohol marketing that is seen on social media sites. So that will be the next step of this study. Thank you very much for this opportunity. I would like to acknowledge the funding for this study from the University of Kelaniya and the University Grants Commission, and also for the opportunity and supervision done by the University of Auckland, New Zealand. Thank you.